Hello everyone, I'm Nawaj Hussain, DGM Marketing from CNS Division. Thank you, Dr. Mehtry, for joining us today on World Mental Health Day. It is often said that there is no health without mental health. Right. And in our country too, the majority of the population suffer from mental health. Right. So as a part of our Break the Silence, Break Awareness campaign, I'd like to ask what causes mental health problems?
So when we talk about the causative factors of any psychiatric condition or mental health issue, there is no one particular single reason where we can exactly pinpoint and say why this happens. Psychiatric disorders, mental health, it's a very complex structure where there is a biological basis, there is a psychological basis, and then there is social basis to it. So to talk about a few factors, we call it as risk factors. The more the number of risk factors a person is having, the more is the possibility of person having any kind of psychiatric issues. So what are some of these risk factors? One is genetics. Mother, father, any other close relative, if they have similar kind of issues, any kind of psychiatric issues, the possibility of a person having similar kind of issues tends to increase. Then any other kind of brain issues, be it traumatic brain injury, any other kind of infections which affects the structural integrity of the brain might also lead to certain psychological consequences. Then certain psychological factors, like let's say past history, childhood experiences, was there any kind of traumatic experiences, any kind of abuse, upbringing, though at that particular point of time it might appear to be very minor, very trivial, but it does tend to have long-term psychological implications. Then social factors, external surroundings, family support, emotional support, they are protective. Stress could be anything. It could be financial stress, it could be emotional stress, it could be other factors. Then apart from this, there are other issues also, other factors like let's say presence of any kind of physical disorders might also act as a risk factor. Presence of substance use like alcohol, cannabis or any other substance abuse might also implicate in causative factors. So in this way, there is no one particular causative factor, there are multiple risk factors. The more the number of risk factors, the more is a positive person having any kind of psychiatric issues.